Welcome to another episode of Health Coach Talk. Today, we're talking all about jobs for health coaches, because that's a question we're frequently asked about. Will there be a job? If I decide to become a health coach, what will I do with my training? Well, the answer is that there are many roles for health coaches, and they're varied. Some people are entrepreneurs. They want to build their own businesses. Others want to work in businesses. They want to work for corporations that are interested in furthering the health of their employees. Still others want to work in medical clinics, and that field is growing. More and more doctors are specializing in functional and integrative medicine. They know that they need a health coach. There are also increasingly roles for health coaches in companies like Quest. Quest Diagnostics now has a branch that is offering health coaching. So the future is bright. And I also want to say that on behalf of FMCA, we are committed to supporting our graduates. We have a very active and growing job board. We encourage companies, we encourage doctors to submit job descriptions, and we are committed to supporting our graduates in helping them feel confident, feel secure in seeking a job. And that is a big part of what we do through our alumni program. So yes, future is very bright for health coaching. I'm going to be speaking a lot more about that during this coming year. So without further ado, though, I want to tell you about our special guest who talks about the job market. And her name is Leslie Wier-Fincher. Let me tell you about her. She has over 16 years of experience in human development as an advisor, an educator, and a coach. She has an ICF PCC, that is the International Coaching Federation. She's a nationally board certified health and wellness coach, and she has 2 master's degrees in education and coaching psychology. She currently works as a health and wellness coach in digital health and has also taught, mentored, and managed hundreds of coaches. She's deeply committed to the transformative potential of coaching to improve societal health, emphasizing the vital role human coaches play in this transformation, recognizing the challenges that coaches face in this rapidly evolving health coaching industry. She launched the Health Coaching Jobs newsletter to provide valuable resources and career development support. Building on this initiative, her business, Well Venture, aims to deliver innovative career solutions for health coaches. So without further ado, here is my conversation with Leslie. Welcome, Leslie.
Thank you so much. I'm happy to be here.
So, well, I would, before we begin, I would love to hear you tell your story as to why you chose to focus on what you are currently doing, which is the employment or the outlook for health coaches, both those running their own business as well as working for others.
Yeah, that's a great question. I think it probably arose from my own frustrations, honestly, in sort of the job search and looking for work, and just kind of hearing all of the pain points from coaches. I have always really loved supporting coaches. I've taught for an NBHWC approved program. I've been a coach mentor, a coach manager. It's just, I love working with coaches. And so that the combination of that and my own challenges and experiences in the job search process is kind of what led to me trying to find some sort of a solution, or at least a starting point of a solution for all of the pain points that coaches are currently experiencing in growing their career.
So can you describe exactly what it is that you are doing currently?
Yeah. So I run a newsletter. It's called the Health Coaching Jobs newsletter. And basically, I curate all of the latest remote health coaching jobs that I see. I wish I could do non-remote, but that is a task in and of itself, you know? So I curate and send out bi-weekly the latest remote health coaching jobs, and also sort of industry trends, answering questions related to their career growth and development process, news, and just kind of bringing together the patterns that I see in the industry in relation to career development, sort of beyond this idea of having to start your own business, right? Kind of bringing into the spotlight the concept. There is another route. It's a challenging route, just like building your own businesses is a challenging route, but there is another one, and there's not a whole lot of talk around that right now. And so that's kind of what I'm doing.
Well, I love your mission, and we have close to 5,000 graduates and growing. And I know that many of them are launching or are running their own businesses, some very successfully, many very successfully, and others are wanting to work for medical practices. Many work for corporations. So can you start by just sharing what are the range of options out there from somebody who wants to be completely entrepreneurial to somebody who says, no, I want to be employed?
Yeah, and I think those are like, if you think about like a number line, for instance, those are kind of the two extremes, and there's a whole lot in between, right? You've got someone who's like fully employed by like someone working in a digital health company, for instance, versus someone who is fully within private practice, right? And then in the middle of that, you have a whole lot of people trying to find their way of what's in between. People who are freelancing, maybe who are in provider networks and have multiple contracts with different companies who provide, coaching to the EAP programs. Or you may have someone who's working part-time with their own, in their own private practice, and maybe contracted within a doctor's office as well. And so there's a lot of what I'm seeing happening now is a lot of people just kind of like combining a lot of different ways to work in health coaching, which is why I really think that just entrepreneurial skills in general should be something any health coach has, whether or not you're solely working in like a company versus anything else, So there's I'd say those are the two kind of end points, and there's a whole lot happening in between.
Yes. And it does not have to be either or, which I find some people
Correct.
think that you have to be in one or the other category.
Right.
But it reminds me back in the day when I was a health psychologist and I had many, many private clients, but then I also was on staff at local hospitals, and I did inpatient consultations, and I worked for some doctors as a consultant. So a whole variety of things. And we're seeing lots of those kinds of opportunities. The other day, I want to share this because I was so excited. This came to my husband. He's on their email list. This was from Quest Diagnostics, the lab testing, the company that they have sites all around. Almost every location in the country has some version of Quest where you can go get your blood draw. And they had as the subject line of this email, are you interested in working with a health coach?
Oh, that's
fantastic. You open the email and it went on to say, yes, we have health coaches. Another example is one of the big hospital systems here in the Chicago area. I know somebody who is going through their cardiac rehab, and they got an announcement saying that it'll help your progress if you work with a health coach. And I thought, wow, yes, because this is an establishment, a big medical system, and all I had been hearing years and years ago when when health coaching was first coming into being, let's say 10 years ago, is that, well, no, that we don't have the budget. We don't know what to do with health coaches. This is now going mainstream. So can you share what some of the top trends that you are seeing in the coaching industry?
Yeah, particularly in relation to like employment and things like that, there are a few things that I'm seeing. One is greater specialization. So I think, when I first started working as a health and wellness coach 7-ish years ago, that was barely existed sort of on in the kind of limelight, and now it's everywhere. But back then it was like health and wellness. What does that actually mean, Now I'm seeing functional medicine as a specialization. And this is working for companies and doctors and all kinds of employers. Functional medicine is a big one. Diabetes is a big one. And pre-diabetes, mental health coaching is one that I'm seeing a lot of, and it's just growing and growing. And then of course, weight management and support for GLP-1s is also a huge one right now. But generally speaking, like greater specialization and looking for coaches who have experience with those populations to some degree, with those specializations. Every functional medicine role I see requires a coach have experience with functional medicine coaching, not just health and wellness coaching, functional medicine coaching, right? And so that's just a really good example.
Well, that's music to my ears, because that's what we teach. We teach those functional medicine principles as a collaboration with the Institute for Functional Medicine. And it is a way of really helping people understand root causes of their conditions.
Yeah. And it's interesting because whenever I see a functional medicine role, there's this is one of the only specializations that I typically see the employers requesting specific schools. FMCA is almost always in there. IIN sometimes, Duke sometimes, but FMCA is the one that I see the most often. So that really speaks to your reputation for sure,
Well, thank you. So let's talk about, there's several directions we can go, but let's talk about the challenges first. Like, what do you see holding people back or from growing in their career?
Yeah, that's a great question.
Given all these opportunities that you're seeing.
Yeah. So there are things that are sort of within their control and things that are sort of without their control that I think all come together to kind of create this kind of what feels like a mess to a lot of people, I think on one hand, you have an industry that is flooded with coaches, and not enough jobs. Right. And that's on the employment side of things as opposed to the business building side of things. But there are so many coaches coming into the industry and there's just not enough actual jobs for them. So that is a challenge. And what that means then is that, and especially, several years ago, there was this kind of situation in digital health where there were a lot of layoffs that flooded the market with a lot of more experienced health coaches. So all of a sudden, you've got all these employers who have this huge pool of coaches they can choose from, and they've got their pick, right? And so they're going to go for the people who have the most experience, and there are a lot of them out there because of those layoffs initially and things like that. So you've got a lot of new coaches coming in that are competing for jobs, for less jobs, with people who are a lot more experienced or who are in demand, essentially. So that's part of it. I think another part of it is just getting that experience, right? How do you get experience for a job when there's no jobs to get experience from? And I think a lot of coaches immediately go to this thought of, oh, I just need to get more education and I just need to show how passionate I am. Those are great things. But ultimately, that's not what employers are looking for. They're looking for experience. Experience and competency trumps education and passion. And so I think what holds a lot of people back is that they're afraid of just going out into the community and finding opportunities for experience. Sometimes it might mean, unfortunately, unpaid. It might mean working at a church and in a community. It might mean having to pitch yourself and put yourself out there. And those are the entrepreneurial skills that coaches really need to get experience in a really difficult sort of landscape right now that they have not been taught.
Yes, I agree that that is often tied to mindset, what you just mentioned, because it's a belief that I can't do it or I don't know enough. And I see that all the time where people will go from one, they're through with our program, and then they say, well, I need to go to another program. I need to learn, and they will keep going from one program to another and never really get out there in the marketplace. And the marketplace, as you said, can be holding a workshop in your church. It can be gathering people in your kitchen and starting a group. It can be volunteering, but there are also ways that you can talk to doctors, for example, or talk to people in companies who are hungry for this, and they just don't know it yet. or they just don't know how to go about it. So it is finding the opportunity to provide that education that you have as a coach, that passion that you have, that will come through when you are interacting with these people who are in a capacity to hire you, whether hiring you as their personal coach or hiring you for their patients or their employees. It's just just taking a risk. And then with practice, you'll get better and better at it. So you talk about career capital. What would that be? What's essential in order to grow a sustainable career in this field?
Especially in health coaching. So career capital, the skills, the amalgam of skills and experience that you have that sort of make up your career, right? And I think what is really essential for coaching in particular is something that we kind of just spoke to. Obviously, you have to have really good coaching skills, right? Not just the education, not just the passion. You have to show that you have those skills. And the reason I say that is because, like, when you go through an interview, you're going to go through mock scenarios. You're going to have to do mock coaching. They're like, especially on the employer side, maybe not so much on like working with doctors as contractors, but especially on the employer side, they're screening for your actual coaching skills. So that's one thing. The second thing that we've already mentioned is entrepreneurial skills, right? Even if you are working for an employer, a lot of the time, and this is coming from my experience in digital health, a lot of the time in larger companies, they don't always know what coaching is and what it does. And so you have to be able to like advocate for yourself, right? And you have to be able to advocate for yourself in all ways, I think, in this industry right now. I would say also experience with different coaching modalities is helpful. So if you're applying to a digital health coaching role that is text-based coaching, they want to see that you have experience with text-based coaching. It's the same skills, it is applied differently than face-to-face coaching. And I've taught both. I've taught, back and forth, coaches who are used to face-to-face learning how to do text-based, and coaches who are text-based learning how to do face-to-face. It's a shift. It requires really intentional skill building, right? And then face-to-face, phone. I would also say experience with certain populations. So if you're applying to a job in which the population is, like people with chronic health, like long-term conditions, the employer wants to see that you have some sort of experience with that population, not necessarily coaching, but that you understand the population, right? And then I would say finally, like one of the most important things, like relationship building. One of the greatest ways, and this is just in general, employment in general, not just in health coaching, it's hard to get a job right now in a lot of industries. It's incredibly competitive. Who you know and being able to get your name out there is one of the greatest things that you can do for your career.
I think that is so important. So we have an alumni program, and that's one of the things we stress. And when I'm having students and graduates in my office hours, we always talk about that. There's a saying that I love: your network is your net worth. And so it is focusing on who do you know, and you start in your community. Start with, if you have kids, the parents of those kids, who's in your school, who's in that PTO group, who's in your church or your synagogue, who do you meet at the supermarket? I mean, it's just yesterday, I went to a book signing and at my local bookstore recently, and the person he was an oncologist, board certified oncologist, and the more he talked, the more I thought, well, I really want to get to know this person. So I was bold. I went up and gave him my card. We had a conversation. Then we connected on LinkedIn, and I said, love to have you on the podcast. And he said, oh, great, I'll have you on mine. So it is taking that risk. So rather than I could have just walked out. It was a crowded book signing. I could just walked out, but said, no, we have a lot in common. I want to get to know this person. And so looking for any opportunity to grow that network. And it starts with those personal relationships. And there was a famous marketer who had, in the old days, it was a Rolodex, but he kept these notes, like he knew what, each contact, he would have their kids' names, their partners, like if they played golf, if they liked tennis, and then it was an opener. Oh, how's that golf game going? Oh, I heard your son went to this college. How's he doing? All of those details. And I have a child at the same college. You look for those common threads, and then they know you. Many years ago, when I was a psychologist, I was seeing a lot of people for migraine headaches, and started seeing a lot of kids. And I always loved ballet. I was taking a ballet class. The woman who I was in awe of for her ballet dancing skills with me at the bar, turned out she was a pediatric neurologist at one of the major hospitals. We started to talk, and from then on, she must have sent me hundreds of kids with migraine headaches to help with biofeedback. Who knew that talking to somebody in my ballet class, having that connection. So be open to those relationships and finding that common ground. And that is a real tried and true in marketing. There's Robert Cialdini, who's a professor emeritus at Arizona State, wrote a great book called Influence. And he talks about that the more you have a sense like that person says, I'm like you, the more you are to want to work with them, to buy from them. And so it's that common ground. Oh, we went to the same school, I really am passionate about teaching coaches that philosophy.
Yeah. And I think a really important part of that too is I think some people cringe at the thought of networking, right? I got to put myself out there. But it's really, I don't like to frame it as networking. I like to frame it as relationship building, right?
Yes.
And it's about not what can the person give you, what can this person do for me? It's what can I give to this person? And eventually that will come back to you tenfold, right?
Yes.
And so I think that's what I always encourage people to go into it with the mindset of, is just be your authentic self, create the relationships that you would normally create, but put yourself out there with the intention of giving rather than expecting, and it'll happen.
One of my mentors, who is on our business track faculty, Joe Polish, he has put Life Gives to the Giver and What's in It for Them. This is another one of his books. And if you approach that way, because many coaches really think sales is a dirty word.
Yeah.
And so because they come to this profession to serve others. And then faced with marketing themselves and selling, that can be something that is off-putting. Can you comment on that?
Yeah, gosh, I'm reading a book right now by Daniel Pink, and forgive me, I can't actually remember the name of the book, but he talks about this very thing. And I was thinking, this is a great book for coaches to read, because it kind of helps reframe this idea of needing to sell, right? He reframes it as needing to move someone. And as coaches, that is exactly what we do in our job every single day. We build relationships and we help create movement, right? So if you employ those coaching skills in a similar way, like the rapport building and how you help move people in your coaching, it's no different, right? And I think something that stood out to me, the way he framed this is we are every single moment of our lives trying to convince someone of something, right? You're a parent, you're trying to sell your kids on vegetables, right? And so I think it has helped me so much to remove the stereotype of a salesman, and consider that what my job is to help move people.
I love that. We will put the name of that book in the show notes. And who is the author again?
Daniel Pink.
Daniel Pink. Okay. So let's talk about the industry in general. How can the industry move forward to support the needs of coaches that you are seeing?
Yeah. So I think there's the education side of things, and then there's the employment side of things. education wise, I think there's a really deep need for greater alumni support. And I think FMCA is kind of a really great example of this, right? Like I am always seeing the question from people who are interested in coaching, which program should I go with? And I tell them, go with the program that has the best alumni support, because when you're done, you're going to be left wondering what's next. And most of them are not going to give you any sense of direction or support. Right. And so the education programs that are building on alumni support and who are seeking to develop greater alumni support, those are the ones that I think are going to be the most successful. And then another thing in relation to education too is like right now, our industry, the coaching education industry is flooded with all kinds of education, CEUs, coaching programs. And as a teacher, objectively saying this, they're not all the best quality, unfortunately, right? And so we really, as an industry, need to focus less on quantity and more on quality. And I can see why we have gone in this direction, right? People are unable to find clients, they're unable to find work as health coaches. They go into creating CEUs as another form of income and things like that. I totally get it. And I don't know that it's actually helping us, because it just kind of lends to that perception, oh, I get that one more CEU and I'll be worth it. I'll get that to get more education and someone will want me, right? And so I really think we need to focus on quality. And sort of robust support as opposed to quantity. And then industry overall, I would say one of the biggest pain points is, I don't know if you've looked at a job listing recently and seen the salary, but it's bad. It's bad. Like when I see a job listing that requires a master's degree and board certification that only pays $22 an hour, that's a problem. And so I think just greater advocacy, greater dialogue around this in general really needs to happen. And that's something I'm trying to start doing and figure out what it looks like, having conversations in circles and on LinkedIn. But I feel like we really need to bring this into the open and just be very, I don't want to say forceful about it, but more explicit, I guess, is I think what we need to be doing, because the salaries are not good.
So I think that what you said earlier regarding a jumping off point to begin with taking that salary, but supplementing it with having private clients, for example, having other ways that you can grow, but realize that this is not going to be where I end up. Also, I talk to a lot of people who say, well, they look at what they are, like, for example, in a medical office in alternative medicine. Well, they are struggling. If you hire a coach, and it could be a low starting point, but then they are bringing in clients. They are tied to the mission of the practice, and so everybody's thriving, and then that salary can be increased. Or you can become an independent contractor. So you may be working on Monday for one practice, on Wednesday for another, leading medical visits, for example.
Right.
We are on the brink of a precipice for what I believe will be enormous growth. Because of the changes that we have seen with we want to look at what has happened now in our health and wellness industry. I just heard a statistic that, so I am privileged to know Casey and Callie Means, who have just been blowing up. In terms of, being on Tucker Carlson and Joe Rogan, and they are with RFK, literally going to be transforming healthcare as we know it. And I've been in this business for over 50 years and have never seen such enthusiasm for getting healthy again. And I've, had talks with Callie in particular about health coaching, and he sees that as the route to how are you going to help people on a community level, and it is health coaches.
Yeah.
They are the ones who are going to make this happen, which leads then to, I'd love to hear your thoughts about, because one of the things that could very well be sped up is the changes in CMS, which runs Medicare, Medicaid, to get those transitional CPT codes for health coaches to be the reimbursable codes.
Yeah.
And which, we have been fighting for. But what I am hearing is that this is now going to be expedited
Okay.
to happen.
Yeah, I think there are kind of two sides to this coin that I'm seeing in the discourse around the CPT codes and all of that and getting reimbursed, right? It definitely lends legitimacy to our industry. It makes it easier for health coaches to get reimbursed in different ways, which kind of meets a pain point, like a really significant pain point. And then on the other side of things, what's happening with low reimbursement for therapists right now, for instance, a lot of people are concerned that the reimbursement that coaches do get is not going to be enough, essentially. And so that may force coaches then out of sort of the insurance sphere, the way that therapists to some degree are being forced out of the insurance sphere so that they can make enough money, right? So I think I'm seeing two sides to this coin being discussed, and that is like, how is it going to help? How could it potentially hurt in the way that it has hurt in other areas too, right? And it's really challenging because like it will increase access, and that's a great thing. And also, what does that mean for the reimbursement of like coaches and therapists when when health insurance companies are not giving what is really needed in order to actually have a thriving, business or career. So that's kind of the two sides of the coin discourse that I'm seeing there.
Well, the other promising development is that as this becomes part of the national dialogue and people are waking up and saying they really want to get healthy, we are seeing this explosion of incidents of chronic disease. And
Yeah.
this is they are hearing this on the most popular podcasts. Well, how do they do it? The primary care office is not going to be the place, but it is finding a health coach. And so it could be a real boon for health coaches working privately, the benefit of doing groups, which makes it affordable for people, but also fair compensation for the coach, but also talking to people. There are people who are wanting to work in the medical community, and there are practices they do not know that chronic care management that session can be run by your health coach, as long as they meet the criteria for the diagnosis as with two or more chronic conditions, and the doctor is technically supervising and in the practice. So I think this is a wonderful development. So I like to think that the future is really bright for health coaching.
I think it is. And honestly, there are a few things that are really exciting, right? As it grows, I see, people who are coming into coaching with like experience, like really vast experience in other areas, that are combining that with coaching in really like unique and creative ways that I think is incredible, right? And so that expands our reach. And also, we've got people who have been in coaching for some time now who are entering leadership positions, who are building their own businesses, and those businesses are getting bigger and bigger and really creating greater legitimacy for health coaching in general. So I agree totally that like just the visibility, I think, legitimizes it now compared to 7 years ago. It's night and day, like a completely different planet to some degree in terms of how much more accepted coaching is. Before it was like snake oil salesman, right? So it is very exciting, I think, just to see the breadth of what is happening and the creativity that is happening with how people are bringing coaching into communities and industries. And that's another thing that kind of I didn't get to mention earlier, is like I really see this breadth of coaching intersecting in different places, community health and education, and not just healthcare, right? And so I find that incredibly exciting.
Absolutely. So broadening across industries
Hmm.
and increasing opportunity, but I think also just name recognition.
Yeah.
I was at an event and I actually was listening to Callie Means, and he made that statement like, why shouldn't a mother on Medicaid be able to get a health coach?
Hmm.
And calling it out, from the stage. So that never would have been brought up 5 years ago, for
Yeah.
example,
Hmm.
but it is on the radar. And I think it is a really great time to enter the field of
Hmm.
coaching. And when you have that sense of opportunities in the future, and then how can you, as a coach, have the skill set, which doesn't necessarily mean that you need to take one more continuing ed course, but
Right.
you do need to have that sense of that you are worthy,
Yeah.
you are worth it, and you can advocate for yourself and believe. Many coaches have imposter syndrome
Oh, yeah.
and are thinking they just don't know enough, and I think that's where that needing more and more support comes from. But
Yeah.
just getting out there
Yeah.
and taking some risks.
Yeah. I totally agree. It's really like the imposter syndrome is strong. And I think one of the greatest things a coach can do for themselves is build confidence in their ability as a coach. And that means actually coaching.
Yes.
It doesn't matter who or where or how, as long as you are coaching.
Yes. Yes. So you gain experience, it helps you become a better coach.
Hmm.
And here at FMCA, we support our graduates and help make that a reality.
Yeah. Yeah,
So
absolutely.
yeah. So thoughts about board certification? I guess this question asked all the time. Do I
Yeah,
need to be board certified? What are your thoughts for the National Board for Health and Wellness Coaching?
that's a great question. Do you need it? No. Is it going to help you? Yes.
Yeah.
And one of the things, it's interesting because I see a lot of like discourse, in Facebook groups and things like that about how do you need it? Do you not need it? Yes, no, etc. The reality is I have so much data on job descriptions, and I was surprised at how many have no mention of board certification. There are still a lot of jobs out there that just say certified health coach. What does that mean? We all know it could mean kind of anything right now, so there are a lot of jobs out there that do not even mention board certification. There are more and increasingly so that do. And so if you want to be competitive, then yes. I think another thing coming to mind for me here, another question that I see often is, if I'm going into private practice, do I need board certification? And again, no, you don't need board certification. A lot of people still are not super familiar with it. However, the trend that I'm seeing is it's eventually going to get to a point where a lot more people know about it, right? Because what's happening in the employment side of things is companies aren't necessarily marketing to consumers; they're marketing to employers. Like a lot of coaching is done with like coaching, like in EAP programs and things like that when you're working in digital health or something like that. And these employers, they want coaches who are board certified. And that kind of carries over into the employee who then also learns about board certification, right? So you've got a whole lot of employers out there right now who actually provide coaching to their employees through an intermediary. Those coaches, more often than not, are board certified. And you're over here in private practice having to compete with this, trying to get clients to pay individually when their employer is already paying for it. That's the challenge, right? And so ultimately, do you need it right now? No. Is it going to make your life easier? Yeah. And there's also the question of legitimacy, right? Like the board is bringing to the industry something that's really essential, I believe, and that is like having really solid standards of practice and ethics, the way that coaching should.
Yeah, it shows you have gone the extra mile to meet
Right.
the minimum standard, that you have graduated from an approved school, so you've been appropriately trained. And I think just for the general public, if somebody needs an oncologist, they're going to go, they have put choice with two physicians, they're going to go with the one who's board certified, or some will say, I'm triple board certified. Whoa, that's even better. So it means a lot in the medical community.
It does.
So,
it does. Yeah. Especially because there's so much connection now between the research and board certification, right? I cannot see a role in the medical community not requiring board certification, especially if you want reimbursement one day. Yeah.
Right. Exactly. So who is going to get reimbursed? You will need to submit your certificate, that you are board certified.
Yep. Yeah.
Yes. Well, this has been a fascinating conversation. Leslie, where can people find you?
Oh, you can find me on LinkedIn. Leslie, gosh, I don't know if it's updated to Wier-Fincher since I changed my name. Wier, W-I-E-R. The Health Coaching Jobs newsletter. It's out there somewhere. I think you've got the link. I don't have a website yet for the business. It's coming. I work multiple jobs and I'm in school, so it'll come one day. But yeah, I'd say LinkedIn is probably the best place right now. Yeah. Okay. We will put that in the show notes. Well, it's been a pleasure talking with you. Awesome. Thanks so much.
I love the work you're doing in this field to grow our profession.
Thank you so much.
Thank you. Bye now.
Bye.